Welcome to episode 70. I'm Stuart McCullough, I'm the CEO of VHIA. And starting with this week's Industrial Roundup, and in particular with community health. This week there is another meeting with DHHS with respect to the Long Service Benefits Portability Bill. The key issues remain funding support, certainty as to who is covered, and taking into account existing portability arrangements within the sector. Thank you to all those members who have provided their feedback so far. There is a meeting for bargaining for dental therapists on Friday, and we are currently in the process of obtaining feedback from community health members with respect to the recent public sector outcome. The key issue for community health concerns productivity measures and whether those measures can be realised within community health or not, or whether they have already been realised. With respect to health services, this week we have the Metro HRIR Managers meeting. In that meeting, we'll be seeking feedback from members with respect to proposed items for review. These are a list of clauses that require some kind of further work in order to improve them in the next round of bargaining. The list that we'll be presenting has had input from the overarching reference group, but we'll be seeking more input from members in terms of developing that list and the action items that need to be completed. We'll also be consulting with our rural and regional members with respect to that list in the following week. There's also bargaining for biomedical engineers on Friday. As always, all of our activities are summarised through the VHIA community app. There are instructions about how to download the app available through the VHIA website. If you have misplaced your password and are unable to activate your account, please don't hesitate to contact us. And that's it for this week's Industrial Roundup.
When it's my turn, march up to glory. I'm gonna have one hell of a story.
Welcome to the weekly update, where we go in depth with a particular subject. And joining me for this week's discussion is Workplace Relations Consultant Emma Scott. Welcome, Emma.
Thanks, Stuart.
So Emma, would you be good enough to reveal the clue for the subject for this week's discussion?
I can.
And if perhaps you could hold that up and show it to the camera and maybe describe it for those people who are listening to this podcast rather than watching.
It's a picture of a band called Roger Thwaites and Friends.
Indeed it is. Roger Thwaites and Friends. His friends being Heather and the dynamo and the lap steel, Jazz. These are exponents of country and western music, and according to the blurb on the back, are responsible for foot taping fun. I think they misspelled tapping. So on the basis of the clue, what would you say that the subject for today's discussion is?
Really poor taste in music?
So close and yet so far. Because we're talking about country and western music, that really leads us to the whole country lifestyle, and in particular, a roundup. And today we're doing a roundup of the various service delivery partnership plans. Emma, just in terms of the SDPPs, could you remind members what that refers to?
So that refers to the Service Delivery Partnership Plan that was a requirement under the state government policy to be inserted into the agreements this time round. That is really about addressing productivity and efficiency initiatives so that it kind of pays off for the wage outcomes in excess of 2.5%.
Okay, so it's a state government wage policy requirement. In practical terms, which agreements have an SDPP as part of their terms?
So far there's 8 agreements. We've got the nurses agreement, the mental health agreement, the health professionals agreement, the health and allied and management and admin agreement, the maintenance agreement, the medical scientist agreement, and then we've got the specialists and the doctors in training agreements.
So I understand there's something to be mindful of in the context of the medical scientists agreement.
Yes, for the medical scientist agreement, there isn't actually a clause contained within the agreement about the SDPP plan, but it is in the in-principle agreement that was signed by the parties.
So the S in that case does not stand for secret?
It does.
It does, excellent. And what was the first action point of the SDPP?
Within 6 months, the representatives had to start a service delivery partnership plan working group.
Okay, and just in terms of needing to do things during the life of the agreement, there's a bit of a checkered history about whether things actually occur. What's happened here? Has that time frame been met?
Yes, it has in cases of all of the agreements.
And have the SDPPWGs been meeting regularly?
For the most part, they have. Generally speaking, they're monthly for most of the agreements. The health professionals and the mental health agreement are bi-monthly, and for the maintenance, we're looking at doing quarterly.
Quarterly. I think I originally proposed weekly for the maintenance agreement, but we've settled on quarterly. For those people who are interested in just getting a sense of when those meetings are occurring, it's worth pointing out that the monthly IR report has a calendar of all those events, and you can see when it is those various SDPPWGs are meeting.
Yes.
So just in terms of who attends those meetings?
So far we have the representatives from the union, VHIA, and also the department attend those. And sometimes we get single members attending them. So in the case of the security review, some members have been involved in that process. And also we might have some members sometimes showcasing a particular issue.
I think we've also had some guests as well, so it's been interesting in the sense that it seems to have operated that there is the core group who can invite other people to really add to whatever is being discussed.
Yes.
So the last time we talked about SDPP, which was episode 44, Tim mentioned that some of the initiatives were common across the agreements.
Yes, there are a few, including increasing immunisation and vaccination rates, improving patient discharge times, improving OH&S interventions, decreasing the environmental impact, and then also reducing disputation across the sector.
So we'll talk through a few of those common items separately in a moment, but we might start with the increasing immunisation and vaccination rates, and we're just going to put a picture up now of a recent event that we attended at the ANMF, where representatives from a range of unions attended and got their flu shots together. I think we've also got a shot not just of the group, but an individual shot of me getting my shot. And it's at that point that I realised that I'm the only person who didn't smile as the needle went in. And we then each sent it out through our various social media. Since that period of time, I do believe that there was some kind of shortage in terms of the flu vaccine. I'm not saying it's directly responsible, but I think that event has just was a worthwhile thing to do as a group, and hopefully just encouraged and showed that there was a unanimity in terms of the commitment to getting the flu vaccine. So moving on to the environmental impact and the things that we've done in that space.
So far on a sector-wide level, what we did was a member spotlight podcast for Beaufort and Skipton about their successful strategies for reducing their environmental impact.
I think that involves some kind of biofuel. I should say for members who are watching who have a story to tell with regards to environmental initiatives, we'd love to hear about it. So if it is that someone is watching and they want to tell other people about their particular environmental initiative, they should call the VHIA office and we'll do a member spotlight, because I think there's a real interest in sharing that kind of information, and people are interested in hearing about success stories in that space. What about some of the common initiatives that haven't really developed as yet?
So in terms of those, we've got some occupational health and safety interventions. What we're looking at doing is doing a best practice guide on bullying.
It's interesting, in the context of bullying, it feels like a piece of unfinished work.
Yes.
In the sense that there have been some very important things, such as the VHIA report, but in terms of an approach across the sector, that's not really come to fruition as yet.
Yeah, correct.
What about improving patient treatment times?
So what we would like to do is another member podcast like we did for the environmental initiatives. So again, it's about sharing ideas across the sector to help improve those patient times for discharge.
All right, so that sounds like one of those things where we're seeking input from members. And just for those people who are watching, you'll see the telephone number appearing on your screen. Our operators are standing by to take your call. So if you have an initiative that you would like to share with other members in this sector, please give us a call and we'll arrange for a member spotlight podcast to be done at your premises. Just in terms of some of the SDPPWG items that are specific to individual agreements.
Yes, so we've got reducing disputation, so that's also common across the agreement. So for the health professionals, we've done a lot of work on some guides. So the guides include the higher qualifications guide, letter of offer guide, a fixed term clause guide, a safe staffing and workloads guide, as well as a backfill guide.
It's probably worth mentioning at this point that where we do complete those sort of guides or user notes or whatever, some additional piece of information, where it's posted, that it's posted on the same page that has the agreement. So if people want to find an allied health professionals guide, open the page through the MyIR portal on the VHIA website that has that agreement, and that's where you'll find the completed user guides as well.
Yes.
I think one of the interesting things about that process for me is that engaging at a really micro level over a clause with a particular union, you actually really flush out where you do agree and where you don't, in a way that bargaining doesn't necessarily permit. And as we're entering the stage where a number of our major agreements are now in that review stage, and we're trying to identify the areas for continuous improvement, it helps really bring to the fore where the issues are.
Yes.
When we've had those discussions. So lots of stuff happening for health professionals. What about nurses?
So for the nurses, what we've done for the disputation is the long service leave guide implementation guide. We've done that through the SDPPWG, and then also ongoing implementation issues are being raised at those meetings.
And doubtless, I think people have come with us on the journey for the long service leave implementation guide.
Correct.
I think that process is of itself entitled to long service leave at this point. In terms of the health and allied and managers and administrative workers agreement.
So the SDPPWG was used for the finalisation of the bulletin regarding the clerical translation, and again, any ongoing issues related to that translation has been raised and sorted through the SDPPWG.
I think we've also got, under that particular one, a lot of items coming up.
Yes.
So there's work to be done, particularly around October this year. And just for those people who have asked whether there'll be specific podcasts or events around those items, well, yes, there will, and those are scheduled.
Yep.
Just in terms of improving occupational health and safety interventions.
So for the nurses, they are scheduling a occupational violence and aggression forum. So they're looking at doing that, and then also the work being undertaken in relation to general OHS and return to work matters, as well as fatigue. So that's going to involve putting some information together and possibly some education modules.
We talked before about the reducing environmental impact and the general sort of activities that are being done. But what specific activities are occurring in the context of, say, the nurses agreement?
So the ANMF had a sustainability conference in April. So they conducted that, and that was available to members to go to, and ANMF members. And then also there has been a sustainability officer that's appointed through Sustainability Victoria that's starting to coordinate contacting the industry contacts to talk about environmental initiatives.
So that's a project officer role which
Correct.
has been brought into the sector to help get greater coordination.
Correct.
Fantastic. And in terms of, I think one of the things I find really interesting is that this has been a mechanism for continuing engagement. So traditionally speaking, I think that the only way that we've continued to engage with unions about the meaning of a particular clause has been in the context of disputes.
Yes.
And this has actually provided a forum for us to do that in a different way.
Correct.
So what's the status update about some of those those individual initiatives under the different agreements?
So the guides were close to being finalised for a number of them. There are some specific ones for health professionals that we haven't really worked on yet, but once the guides are kind of finalised, we'll do that, which is in relation to workload, and then also training for managers in terms of information and expertise, doing some training on that. But also we did use the SDPPWG to put forward the health promotion structure. So the next meeting we'll be discussing that in depth, and then we'll get onto the individual issues such as the workload and the training.
There's an interesting contrast here about the fact that things are occurring,
Yes.
and that ultimately this will support not just the implementation of these agreements but the review of those agreements as we
Yes.
move into the next round.
Definitely.
Just in terms of the nurses then.
So for the nurses, most people would be aware that there's a nurse unit manager review going on.
There have been a lot of emails.
Yes. So we sent a bulletin out that had a survey related to that, and we've extended the deadline just to make sure that we've got enough information for the review about really introducing a 3-level structure is what that's about.
Okay. And in terms of there's the statewide classification committee under that agreement as well.
Yes.
Does that form part of the SDPP process?
It's a matter that is formed under the SDPPWG, but there are separate meetings occurring, and the meeting is going to occur in September, and in the first instance we believe it's really going to be focused around advanced practice roles in nursing.
So speaking of the nurses agreement and community health in particular, one of the items that is still to be done is a review of the nursing structure within community health.
Yes, so that's a part of the SDPPWG, but it hasn't been discussed at those meetings yet, but we've started to do some background work on that with community health by forming a subgroup to assist us in that process so we can start having those discussions. So getting something together with our members first before we start that process with the actual SDPPWG.
It's interesting. I know that that's been a task that was supposed to occur under previous agreements and didn't. I think the difference this time around is that there is a framework by which to get those things achieved.
Yes.
So it's just in terms of the health and allied and managers and admin agreement. Anything else for that?
So that agreement's quite different in terms of matters that are specific for the SDPPWG. There aren't any that are specific just to that agreement, but we are discussing with the unions the security review process through that, and then also the patient transport review. So with the security review, that work is well underway, and the reviews and the outcome is meant to be implemented by the 1st of October this year.
Okay, and what about the patient services review under clause 110?
So similar idea, although discussions have only just occurred, so it's not as it's still a working in progress towards the start of it rather than closer to the end. But yeah.
One of the other agreements that has some specific initiatives that are unique to that agreement is the medical scientists agreement, and there are 2 particular initiatives that apply under that.
Yep. So there's one that is related to an academic study regarding rostering in pathologies, where a university has been engaged, and they'll be doing interviews and focus groups around rostering in pathology services for, I think, 4 health services.
Is it around fatigue or?
I think it's just about general rostering with fatigue and work-life responsibilities, and just a mix of different issues that they'll then be doing a report and recommendation on.
And when is that study likely to be completed?
It's expected to be completed in November this year.
And what about the second initiative under that agreement?
So the second initiative is about the relief pool and creating a statewide relief pool.
That is a pool of available staff to replace people who are absent?
Yes.
And where is that up to?
So that's only in its infancy, so they actually haven't, the department hasn't made a decision in relation to costs to fund what might be required for administering and setting up that relief pool.
Okay, so work has commenced, a proposal has been put, it's under consideration.
Yes.
What about the mental health agreement? Are there any items specific to that?
There are items that are specific to that haven't been commenced because the parties have been really focusing their discussions on the workload management, staffing. But there is some stuff coming up with implementing VIMS too, and reducing paperwork related to caseloads and all that kind of thing. Yeah.
Okay. And in terms of, I think it's worth just noting that there are some specific items under the doctor SDPP clauses,
yes,
both for the doctors in training and the medical specialists. And indeed, I think there is a specific podcast episode just about those SDPPs. It might be episode 69. That probably provides a neat jumping off point to wrap it up this afternoon. Thank you so much for taking us through the SDPP process. Just worth reiterating again that this is now going to feed into the review process,
yes,
and be something that is very useful as we start to prepare for the next round. I think there's no better way for us to finish up today than to head out with the dulcet tones of Roger Thwaites and friends. Thanks, Emma.
Thanks, Stuart.